Jonathan Young.
Thank you, Mr. Speaker. Sir, the Salvation Army's report into the state of the nation in 2008 expressed incredible disappointment that the investment that was being made in social services and care for people was not producing the result which they hoped. Sir, there are challenges that New Zealanders face and governments face all the time. So laying everything at the feet of the government is an easy blame game to play. And I would just suggest that the previous speaker go back and read that report from the Salvation Army regarding her government at that time and consider those words that were said. So what we need to understand is that during the most difficult of times that this nation faced financially, that the health budget in this country continued to be increased year after year. If you go back, sir, to 2012, you look at what was happening in, for example, Ireland, how they cut out $200 million of their health budget at a time when we increased ours by 3.4%, where they ended up with an $800 million deficit and where, sir, many health professionals lost their jobs. A time, sir, when we, as we have done year after year after year, increased health spending, increased accessibility for elective surgery, increased the number of doctors and nurses and midwives, and we have made it possible for hard-to-staff places like rural Taranaki to have access to health professionals through our bonding scheme. Sir, in a time when things were very tough around the world, out of all the 27 countries the OECD measured, we were third highest for health funding. So, sir, the rhetoric we hear today does not have any data or fact behind it. It's political bias and it's misinformation. Sir, what we understand is that New Zealanders need to have confidence in whoever governs their country. We have been returned for a third term, and that's not a statement of arrogance, as other people would say. Sir, it's just the fact that New Zealanders have had confidence in this government, and principally it's because of the gains that we have seen achieved over these number of years in the face of great challenge and great difficulty. We have seen more people, more children involved in early childhood education. We have seen more people receive surgery. We have seen more doctors and nurses trained and be involved in the health profession. So we have seen many, many achievements. And that is why today the Minister of Health has decided to put commissioners into the Southland DHB, because the gains that we expect for the benefit of New Zealanders and the taxpayer are not being seen in that DHB. So health budgets are under pressure all around the world and in this country. We in Taranaki have had the tremendous advantage of having a new hospital built. And so from all accounts of what I hear from people who have gone into that hospital for surgery and for appointments, the facility and design itself has facilitated a far higher ability to offer health care and get more people to that place and receive the benefit of that. So all of that is absolutely necessary, and if we want to see New Zealanders cared for in such a way that we desire. But sir, in order to have those efficiencies, those modern buildings, sir, we've got to have a strong financial management of this economy. And by and large, sir, I think that is what New Zealanders have seen in this government. They are seeing the benefits, sir, of prudence. They're seeing the benefits, sir, of discipline. They're seeing, sir, the benefits when the Prime Minister listed off a whole list of better public service targets and the work that we have done to achieve it. Thank you, sir.
Speaker.
Eugenie.